welcome to another episode of PHI, Public Health Impact. I'm Cham Dallas.
And I'm Phaedra Corso. In today's episode, we're talking about infectious diseases. Now that is such a broad topic. There are so many different infectious diseases that we could talk about today. They impact every segment of our population, and they impact the U.S. and internationally. You know,
Phaedra, it seems like every week there's some new infectious disease that we see, whether it's the influenza season that we see every year, or an outbreak of salmonella in the food, or that recent outbreak of cholera in Haiti.
Yeah, and you know, the crazy thing about these diseases is that each one of them has their own unique profile. So this really represents a huge challenge for our public health professionals who are trying to deal with the prevention and treatment of these diseases.
In an earlier episode of PHI, we covered influenza, a disease which covers people of all ages throughout the world. In 2009-2010, a flu virus, which we called 2009 H1N1, was spread worldwide and caused a disease outbreak that we hadn't seen in over 40 years.
In addition to viruses, infectious diseases can also be caused by bacteria. So an example of that is pertussis, or some people know it as whooping cough.
And people with one infectious disease, once they contract that, they then become susceptible to many other diseases.
Well, the good thing for our public health professionals is that there are many methods and techniques that we can use to prevent the spread of these infectious diseases, and one of them is vaccination.
This is a great example of what public health is all about. Once we have a policy and a management practice that we know is working, it's up to us to implement them to help the spread of disease from occurring.
And here at the University of Georgia, we have an incredible group of faculty who have really devoted their entire careers to looking at the prevention and treatment of infectious diseases.
Well, Phaedra, today we're going to take a look at some of those faculty members, and we're going to determine really what research we're doing and how we're going to prevent the spread of infectious disease, not only here in Georgia, but around the world.
During this show, we're going to find out what infectious disease really means. And we're going to do that by looking at infectious diseases here in the United States, and then we're going to broaden our scope and look at infectious diseases globally. And then we're going to come right back here to home and figure out how we can prevent the spread of infectious diseases right in our very own communities.
Let's begin with Dr. Chris Whalen, professor in the Department of Epidemiology and Biostatistics and a medical doctor. Infectious disease is a big topic. Can you help us get a better understanding of this? What is infectious disease?
Well, an infectious disease, Cham, is an illness that's caused by a microorganism. A microorganism is a small, microscopic cell or particle that can survive in our body or in the environment.
So I'm hearing that there are different ways of getting these infectious diseases. Why don't you tell us a little more about how these diseases are spread? What kind of microorganisms are we talking about?
Well, sure. There are generally 4 different types of microorganisms. They're called bacteria, viruses, fungi, and parasites.
Okay, how do these different microorganisms cause disease?
Well, when the organism enters the body, it finds a part of the body or a tissue that it likes. And in that tissue, it begins to replicate and multiply. During that process of replication, it disrupts the normal physiology. And that when the normal physiology is disrupted, we develop symptoms. And it's those symptoms that we recognize as the infectious disease.
Okay, so now we know how these diseases occur. How do they spread?
Well, one of the unique features of infectious diseases is that they can be spread from one person to the next. That's unlike chronic diseases like diabetes and cancer. There are generally 4 ways that infectious diseases can be spread between individuals. One is through person-to-person spread. A second is airborne spread. Third is through something called a common vehicle. And fourth is through vector-borne spread.
So can you explain these modes of transmission of disease?
Sure. Person-to-person spread requires close contact between an individual who is infectious and a susceptible individual. A good example is chickenpox. Airborne spread occurs when an ill person coughs or sneezes. They aerosolize millions of particles, and if someone who's susceptible comes along and breathes those particles in, they may become infected. Tuberculosis is a good example of that. Spread of infections through common vehicle occur through our water supply or food supply. The recent outbreaks of salmonella infection is a good example. Finally, vector-borne infections are spread through an intermediary organism like a mosquito.
So that's how these infections cause epidemics in the population. In the rest of this show, we're going to talk about the research in infectious disease and how we'll understand how this occurs and how to prevent it. As we've discussed on PHI, the College of Public Health here at the University of Georgia is dedicated to promoting health as well as preventing disease and injury. We're now being joined by Dr. John Vina, who heads our Department of Epidemiology and Biostatistics. John, why don't you tell us about what's going on at UGA in this important field of infectious disease research?
Yes, Cham. Here at UGA, we have some of the leading faculty members in the world addressing infectious disease, both locally and globally.
Okay, and this research is interdisciplinary then, involving, as I understand, over 100 faculty from across the campus.
Yes, UGA has what we call the Faculty of Infectious Disease, and we have members in public health, the veterinary school, specialized centers and institutes addressing infectious diseases, how they're transmitted, and all the different bugs that cause them.
Now, here at the College of Public Health, I understand in your department we have an MD, a physician for people, that's doing work not only here in the United States, but all over the world, especially in Africa.
Yes, Cham. We have 5 faculty members addressing many different aspects of infectious disease. So you mentioned the physician, Dr. Chris Wayland, who's a physician epidemiologist, and he's looking at HIV and AIDS in Africa, not only its causation, but treatment and prevention, and also is studying tuberculosis, which is a major killer worldwide, but also is studying it here in Georgia.
I also understand that in addition to the physician scientists, we also have veterinarians covering the animal side of the equation.
Yes, we call zoonotic disease the diseases that there's an interface between animals and humans. And so we're very lucky to have 2 veterinarians who also have doctorates in epidemiology. And they're studying both the transmission from animals to humans and bacterial resistance and issues with regard to immunization.
And you also have faculty doing the modeling and the actual measurements in the populations in infectious disease.
Yes, so as we'll learn, the transmission of infectious disease and how it moves and how epidemics move in populations is really important. So Dr. Andreas Handel looks at that as well as how an infection moves inside your body and how your immune system reacts to it. And then we have another specialized faculty member, Dr. Ming Zhang, who is studying the fingerprints of all the different viruses and bacteria and understanding the genetics of those infectious agents. These specialized centers, including the Center for Tropical and Emerging Global Diseases, as well as the Faculty of Infectious Diseases from all the different colleges, the College of Public Health is a big part of that. And in fact, we have both not only our faculty, but also our students that are studying all these different aspects of infectious disease.
So we have it covered right here in the state of Georgia, across the world, with over 100 faculty focused in this very critical area of infectious disease. In this next section, we'll look at infectious disease in the United States. And I'm willing to bet you that many of you have had or know people that have had the diseases we're talking about in this section. We're back with Dr. Chris Wayland, and one disease that I've been hearing more and more about is MRSA. Why don't you explain that to us?
MRSA stands for methicillin-resistant Staphylococcus aureus. It's a bacterial infection of the skin and other parts of the body. MRSA is more difficult to treat than the usual staph infections because it has acquired resistance to many of the common antibiotics, especially all of the penicillins. When people become infected with MRSA, they often develop a mild skin infection.
Now, I've heard that a lot of people come in and they think they have a spider bite.
In fact, spider bite is the most common presenting complaint of MRSA. But MRSA can cause more severe disease, infecting the bloodstream, the lungs, and even surgical wounds, and found most frequently in hospitals. It then moved from the hospitals to nursing homes when patients were discharged for rehabilitation. MRSA can be treated with antibiotics, but those antibiotics are expensive and run the risk of creating more drug resistance. Hospitals take precautions to prevent the spread of MRSA by sanitizing rooms, sanitizing surfaces, by disposing of gloves and gowns and clothing that's contaminated with MRSA, and by using special protocols to protect other patients from those with MRSA.
Now, I've heard that there's a new version of MRSA that's showing up in young people. What's going on with that?
Yeah, indeed. In the 1990s, MRSA started to show up in young, healthy individuals. It came from the community. Doctors were seeing it in their office practice or in the emergency rooms. It continued to cause very mild infections of the skin, but every now and then it would cause a very severe invasive disease, and some young individuals died.
So how is MRSA spread in the population?
Well, MRSA is spread through person-to-person contact, or that close contact. It's often seen in hospitalized patients, as I've mentioned. Athletes often get it because of the shared space in locker rooms. Young children in nurseries have gotten MRSA, as well as prisoners.
So MRSA is a distinct example of an antibiotic-resistant disease that has spread now from the hospital back into the community, and it's presenting quite a problem for us, and there'll be others like it. So now let's talk about an area of importance to everyone that's watching this show right now, and that is the area of food safety. With us is Dr. James Aloya, Assistant Professor in the Department of Epidemiology and Biostatistics. Dr. Aloya, please define for us food safety and infectious disease.
Actually, food safety includes pursuit of uncontaminated, unadulterated, clean and wholesome food that is fit for human consumption.
So what you're telling me is a lot of our food is not fit for consumption, apparently.
It is, but also we may have the risk of having hazards in the food. And these hazards vary from biological to chemical to physical hazards. And of the biological hazards, we have lots of microorganisms in the foods. We may have bacteria, we may have viruses, we may have fungi, and parasites as well in the food.
So tell us something about the microorganisms that are growing in our food, and how big is this problem?
It's actually a big problem. For example, annually, the latest estimate from CDC reports about 10 million cases annually of people falling sick as a result of eating food. Out of the 10 million, about 56,000 cases end up in hospitals, of which about 1,500 die from it. So it's a big problem.
I would agree. 10 million people a year getting sick, tens of thousands in the hospital, and over 1,000 dying is a big problem. So to wrap up infectious disease occurrences in the United States, we have with us Dr. Steve Velika here in the Department of Epidemiology and Biostatistics in the College of Public Health, and one of our veterinary scientists. He's going to bring us up to date on disease which first appeared in the United States in about 1999 and has an animal vector, in this case a mosquito. Dr. Velika, tell us about West Nile virus.
West Nile virus is interesting in that it had never before been seen in the United States until 1999, and in fact was first seen at the Bronx Zoo in some birds that the zoo had acquired. It's a disease that's transmitted from birds to mosquitoes to people. Concurrently, there were some human cases happening, and the CDC was looking into that.
And so this is what we mean by zoonotic disease, or disease that's going back between animals and humans.
That's right, and there are a lot of zoonotic diseases, and many people are familiar with rabies, which transmits from animal bites to people.
And fortunately, a lot of people probably have the impression that West Nile virus is fatal if you just get it. And fortunately for us, that's not the case.
It's very rare that there's any serious complications, but some people will develop what's called West Nile encephalitis, where they get brain swelling that can be dangerous and lead to long-term disability or even death.
So to conclude this section on infectious disease in the United States, I have to ask, what's coming down the pike now?
It's hard to predict exactly, but West Nile virus essentially hitched a ride over here on an airplane. And in this era of globalization, we're just going to see things like this happen over and over.
Now we'll transition from infectious disease here in the United States to the rest of the world, keeping in mind that right here in Georgia we have one of the busiest airports in the world. Dr. Whalen, can you tell us what we should at least be aware of in regard to infectious disease on a global scale?
Well, sure, Cham. There are 3 diseases that cause many millions of deaths each year worldwide, but are relatively uncommon here in the U.S. They are HIV, tuberculosis, and malaria.
Well, people generally know about HIV or the AIDS issues here in the United States. What can you tell us about the HIV pandemic worldwide?
Well, HIV pandemic probably began about 50 or 60 years ago in East Africa. It has since spread so that today there are 33 million cases of HIV worldwide. Each year, 2 million new cases of HIV occur and about 1 million deaths each year due to HIV. Although every country is affected by HIV, the epidemic has hit hardest in sub-Saharan Africa.
Well, what is it that we've been doing about this here in the United States?
Well, here in the U.S., we've played a major role in helping to reduce the burden of HIV, especially in Africa. We give millions of dollars each year to purchase the life-saving medications that treat HIV.
Well, HIV is, as you said, a relatively recent disease. What about that ancient disease of tuberculosis?
Well, indeed, tuberculosis, although it's both preventable and treatable, it remains a threat today to both individual health and public health. About 9 million cases of tuberculosis occur every year and 1.5 million deaths. The sheer numbers alone are important, but tuberculosis poses 2 other problems. One is its close link to HIV. HIV-infected individuals are prone to tuberculosis. Once they develop TB, it makes their HIV disease worse. The second problem is drug-resistant tuberculosis. Drug-resistant TB is developing throughout the world, and people with disease are traveling. Someone may even arrive here in the Atlanta airport with drug-resistant disease.
Okay, so we have HIV and tuberculosis. What other global pandemic type disease would you refer us to?
Well, malaria is the 3rd major cause of death worldwide, affecting mostly young children in Africa. Malaria is a parasitic infection that's vector-borne, that is, it's spread by mosquitoes. Each year, nearly 250 million episodes of malaria occur, and about 2 million deaths from malaria occur, again, in East Africa.
Well, tell us about rollback malaria.
Well, like tuberculosis, malaria is both treatable and preventable. One of the major focuses of the rollback malaria campaign is to distribute bed nets that are treated with insecticide. This prevents the infection of individuals using the bed nets, but when it's used in a village, it actually prevents malaria throughout the entire village. If we can mobilize people from around the world to donate bed nets to this cause, we may be able to roll back malaria.
We're going to turn our attention now to how research in infectious disease is really paying off. There are just certain steps that we can take that we can prevent the spread of disease. And at the top of that list, we're going to turn to Dr. Valeka, vaccinations.
Yep, vaccination's the single most important thing that we can do to prevent the spread of infectious diseases. A lot of people think, why do we need to be vaccinated against these diseases that are so uncommon? And they're only uncommon because we vaccinate for them. With declines in vaccination, you can see these infections reemerge.
And a classic example of that now is pertussis, also known as whooping cough.
That's right. Vaccination rates have declined against pertussis, and as a result, we're seeing more cases and even seeing outbreaks of pertussis. Most of the disease, the burden of disease, occurs in the very young, infants less than 6 months of age. But it's their adolescent siblings or their parents that are transmitting it to them. So when you get vaccinated, you're really protecting this youngest population that can't get vaccinated.
So this really illustrates for us how, even though we know better, when we let our guard down, these diseases will come back upon us. Earlier in the show, we talked about the very critical issue of antibiotic resistance. Dr. Whalen, what can we do about this emerging issue?
Well, there are two ways that we can address antibiotic resistance. One is to prevent antibiotic resistance in the first place, and the other is to prevent its spread. When we think about antibiotics, we think of medicines that will treat an infection and make us well. But there's another side to antibiotics. Every time we use them, we're selecting drug-resistant organisms. You know, survival of the fittest.
Well, what are the practical implications for this? How can we prevent this?
Well, the practical implications are to treat bacterial infections with antibiotics and to avoid antibiotics in viral infections. You can trust your physician to help make that decision.
Well, what about preventing the spread of this kind of antibiotic-resistant disease?
Well, there are a number of things that we can do to prevent the spread. One is to cover our mouths when we cough. The other is to stay home when we're ill. And finally, we should wash our hands regularly and use good personal hygiene. Hand sanitizers help, but they're no substitute for good hand washing.
Now we're back with Dr. Oloya, where we discussed food safety before, and I have to ask you, how can we protect ourselves from infectious diseases in food safety?
Basically, there are three approaches that we commonly use. And this could occur right from the farm up to the table. The first one is to keep these organisms out of your food. Secondly, killing them. For example, adequate heat treatment. And then thirdly, controlling growth so that the numbers do not exceed a level that could cause harm to your health.
So that's what we're really after, is get a margin of safety where we get as many microorganisms out of the way as possible, and we think that we're going to be safe there.
Yes, we can only bring it to a certain level, but we can't actually remove them totally from the food unless if it is a canned food or it is heat treated. So we can only bring it to a level that's considered safe.
And we have to do that at every step of food production then?
Yes, that is right from the farm up to the table. So that means the farmer has to play his part, the processing companies have to do their part, and you as the final consumer have to do your part.
That's an important point, Dr. Oloya, is that, people like you in the food safety area can only protect us so much. Once it gets to the table, then it's up to us. We've only really scratched the surface of infectious disease, but I think we've got an initial understanding of just how important the scope of it all is and how to prevent it.
Well, Champ, just because these epidemiologists develop procedures to prevent disease, like vaccinations, doesn't mean that as a society we're doing a very good job of preventing or controlling the spread of infectious diseases.
Yeah, and so in that classic public health matrix that we've set up in this program, really it's the health promotion behavior people that would then get the information out to help people change their behavior at the individual level.
And then at the societal level, sometimes it's necessary for our policymakers to come in and require people to take certain actions to prevent the spread of disease.
And that's, I guess, almost a frustrating aspect of this, is that by taking these measures, we really can prevent this from happening.
Yeah, and sometimes it's just very small things that we can do, like hand washing to me is the great example, because we know that at the individual level, if we just take the time to wash our hands, we can really prevent the spread of disease.
And at the societal level, we can, as is now done, the hospitals, restaurants, organizations like that can mandate that their employees wash their hands and do other practices that will wrap it up and prevent the spread of disease there.
That's a really great point, Cham. And it reminds us that public health is such an interdisciplinary field. And, you know, once we learn about ways to prevent the spread of disease, then it's up to us as public health professionals and as individuals to take those necessary actions to prevent spread of disease in our communities.
And we want to thank you again for being with us today and encourage you to join us for the next episode of PHI, Public Health Impact.